my absolute privilege and great honor to be invited as a speaker in this exceptional virtual conference, especially being the only radiologist among the wide number of otolaryngologists to present my case, which is about the total aplasia of paranasal sinus and nasal cavity. And this is the first case report, and I hope it will be recognized as Trefa syndrome in the future. I don't have any conflict of interest, and the case has been published by Springer in Egyptian Journal of Otolaryngology in March 22. In the upcoming minutes, I will take you through these points. All right, so the development and anatomy of nose and paranasal sinuses are exposed to a variety of variations and abnormality that leads to patient presentation and complaints. So my patient, which I have been reported, was a young 26-year-old male patient from rural areas who visited an ENT outpatient clinic at my hospital. I am working in Iraq, Erbil city. My hospital is Erbil Teaching Hospital. The patient presented there with complaints of nasal obstruction and mouth breathing since birth. So after they examined the patient, they sent him to radiology department for CT scan of nose and paranasal sinuses for evaluation. When we received the patient, we saw the patient that he was mentally intact, but his face was a bit dysmorphic due to very small rudimentary non-patent nostril. He had a short, flat mid-face, underdeveloped cheek, and absence of nasal bridge. These are clinically visible. And the patient, upon asking the patient, he denies any previous nasal surgery, trauma, radiotherapy, granulomas, or chronic infection in the region of nose and paranasal sinuses. So we proceed to do a thin section bone algorithm multi-detector CT scan of the area, nose and paranasal sinuses. It demonstrated the bilateral symmetrical complete absence of the pneumatization of all paranasal sinuses, with the absence of nasal cavity and associated internal structures. Absent nasal bone, absent turbinates, bony and cartilaginous nasal septum, vomer bone, uncinate process, and nasal process of maxillary bone. All these were missing. And there was also high-riding convex arched heart palate, which resulted in spacious oral cavity. There was also absence of nasolacrimal duct, and there was a thick cribriform plate of ethmoid bone and bilateral patent but medially displaced infraorbital canal and foramen. The structures which were normal in the CT scan of the case that I reported were orbit and optic canal foramen were all normal, lamina papyracea, crista galli, pituitary fossa, and other skull-base foramen, petrous bone, mandible, temporomandibular joint, pterygoid plate, zygomatic process, maxillary incisor, teeth, brain, and other intracranial structure, all were normal. In this section, we can see 3 images of coronal bone window CT scan of nose and paranasal sinus, which demonstrate absence of frontal sinus. We can see that the frontal bone here, there is no pneumatization at all, and also absence of maxillary sinus. This is the side of maxillary sinus. It's also filled with bone marrow as a cancellous bone of maxillary bone with no pneumatization. Ethmoid will be here, but it is absent in this patient. And nasal bone will be in midline. Nasal bone, nasal cavity, all were missing. but the incisor teeth are normal, orbits are normal, and in general, bone density is normal. In this three selected sagittal images of CT scan paranasal sinus, we can see that there is non-nematization of maxillary sinus. This is the side of maxilla also. It is nicely demonstrated on sagittal section. The bone is compact, and also we can see the sphenoid bone is also compact, filled with bone marrow with no nematization. This is the side of nose. There is no nasal cavity, no nasal bone, apart from this small skin flap in the area with no opening and no cavity, with no internal structures. In this section, we can see that hard palate is high riding and convexed because of the absence of nematization in the maxillary area above. This resulted in a very large roomy oral cavity. We can see that this increased craniocaudal diameter of oral cavity as a consequence of absence nematization of the maxillary sinus. And this is the area of frontal sinus also not nematized. Otherwise, the bone density is normal. The next images, we can see the same abnormality, but in the axial section. These are axial bone window CT of paranasal sinuses. This is the side of maxillary sinus, which is absent completely. This is the side of nasal cavity, obliterated, not nematized. This is the sphenoid bone, not nematized, and orbits are normal, and ethmoid also absent completely. These are infraorbital foramen and canal with the nerve. They are normal present. So, understanding the development of nose and paranasal sinuses embryologically is very crucial for interpretation of the abnormalities that we face in our daily lives as a radiologist during interpretation of paranasal sinus CT images. This developmental process of paranasal sinus occur via a series of complex coordinated events that start as early as third week of gestation and progresses thereafter. A wide variety and spectrum of paranasal sinus structure abnormality have been mentioned in the literature. For instance, it has been reported that there is bilateral maxillary sinus severe hypoplasia, aplasia, and combined with aplasia of sphenoid, frontal, maxillary, and even ethmoid sinus abnormality. Other cases have been reported as bilateral aplasia of single sinus and even combined aplasia of sphenoid and frontal sinus, which accompanied by bilateral maxillary and ethmoid sinus hypoplasia. While also total aplasia of paranasal sinus have been reported, but all these cases were not associated with any abnormality in the nasal cavity. And there are numerous syndromic syndromes have been mentioned in the literature, which are associated with anomalies and abnormality in the sinonasal region, which can be broadly divided into two categories. Those due to defect of midfacial skeletal growth, for instance, Richter-Collins syndrome, which also known as mandibular dysostosis, Bender's syndrome, which also known as maxillomandibular dysplasia, Williams syndrome, elephant facies syndrome, Apert syndrome, and Cruzen syndrome. All of these syndromes associated with bilateral paranasal sinus defect. Moreover, the golden hair syndrome, which is also known as hemifacial microstomia, is a unilaterally a syndrome which is associated with the unilateral diminutive maxillary sinus, and it's accompanied by hypoplasia of ipsilateral bony zygoma. So in this syndrome, it is unilateral. Regarding the next category of disease which is associated with sinus abnormality, includes bone dysplasia, which is mainly osteosclerosis. Osteosclerosis affects pneumatization of sinuses by preventing expansion and pneumatization due to compact and sclerotic bone. There are a lot of examples of bone sclerosis like polyostotic craniofacial fibrous dysplasia, craniometaphyseal dysplasia, craniodiaphyseal dysplasia, and many other skeletal hyperosteosis. None of these features applied to the case that I have reported. I mean, all these abnormality detected in these diseases and syndromes, none of them applied to my case report. Additionally, there's a syndrome called Bosma syndrome, which usually hypoplasia of a single sinus, commonly maxillary sinus. In addition to nasal aplasia, but in this case, there will be abnormality in the orbit, and the patient will be sexually abnormal. Lastly, there is a syndrome which is called solitary median maxillary central incisor syndrome. It's a rare complex genetic disorder, consists of midline craniofacial structural defect, which include the nose, in which there will be choanal atrasia and nasal piriform aperture stenosis. Additionally, there will be abnormality in the brain, in particular holoprosencephaly, along with the abnormality of the pituitary gland. Again, none of these components which observed in this case was applied to my case, in which there were the maxillary incisor was normal in my case, and the brain intracranial structures all are normal. So conclusively, among the wide range of anomalous structural defects described in the region of nose and paranasal sinuses, total aplasia of paranasal sinus and nasal cavity and its component haven't been reported to my knowledge so far previously, but have been identified radiologically by multi-detector bone window CT in my hospital in a patient which is from a Middle Eastern patient. And these are part of my references. There are a lot of references, but this is part of them. And thank you for your attention and for this opportunity to present my case.